We just wanted to welcome everyone to Redirect Health. We're very excited to have you join our team, and we're super excited to be able to help you with your healthcare.
Our goal is to eliminate the waste in healthcare, bring down your cost, and make it really easy to get care when you need it.
We know that healthcare can be hard, it can be confusing, annoying, and frustrating. We want to eliminate those things so you can have a great experience. The way we've done that is we've created the 888 number that's going to be on your cards, it'll be on stickers. We want you to just call that number for everything you need. Instead of calling your doctor like you used to or calling the pharmacy, just call that 888 line.
You can call us 24/7, 365 days a year, in English or Spanish. And a member of our dedicated care logistics team will help you with all your healthcare needs. First and foremost, I wanted to share the biggest benefits of your new health plan, and that is that you have a $0 copay and no deductible for primary care and your chiropractic.
That's unlimited. You can go as much as you want, as much as you need to. We want to make sure you take advantage of these visits because they're free.
That would cover all your routine care, but what about all the non-routine healthcare services? We'll talk more about that process in a moment, but for now, you just need to know to call us first, no matter what, and our care logistics team will make sure you have a care plan designed to help you get the care you need at the lowest possible cost.
So for your new member orientation today, we want to talk about 5 things that will help you get the most out of your healthcare plan.
First, I'm going to tell you a little bit about that 888 line, when to use it, and why it's there to make your life easy. Next, we'll talk about what happens when you call that number for routine care during normal business hours. Third, I'll tell you more about the process when you need routine care after hours, when most primary care clinics are closed. Fourth, I'll share how to handle prescriptions so that you always get the best prices. And lastly, we'll discuss all the what ifs and how our care logistics team helps you navigate the healthcare system when something non-routine comes up, such as a broken arm.
So the first thing we're going to talk about today is the 888 line. In the past, you've maybe had to call a doctor or call your specialist or call the pharmacy to get care. What we've done is we've got one dedicated line. It's 24/7 in English and Spanish.
When you call that number, a member of our care logistics team will help you get everything you need and make it as easy as possible.
We know that if you're going to direct your care by yourself, you put yourself at more risk for spending money that you don't need to. And that's why we have this line. We have it there so you can call with any questions you have, benefits, care, anything you need, we're there for you. So the second thing we're going to talk about is our normal business hours call.
Traditionally, when you need care, you'll call your doctor to set up an appointment, but it might take several days before they can see you. And when they do see you, they tend to make you wait in the office and collect a lot of information. They're never on time, right? We've all had that experience.
So what we do is we want you to call into the 888 line.
When the specialist answers, they're actually going to start your visit right there over the phone. They'll collect your medical history and discuss the reason for your call. All the things that would happen in the office, we're going to start to do over the phone. Next, we'll actually get you on the phone with a provider.
Now that provider can diagnose and prescribe over the phone, saving you the hassle and time of driving into the office or having to take time off work for an appointment. But when they can't, that's okay, because now we've got, say, 20 to 80% of that visit done. So when you go into the office now, you don't even have to sit down. You're going to be on time. Your whole experience is different. The medical assistant, rather than asking you all those questions again, we already have it. They're going to just take your vitals, they're going to put you in the room. Instead of the provider now coming in and having to review all the questions and ask them again, they're already done. Your 40-minute visit now can be done in about 10 minutes. So your whole experience has changed. The provider can actually spend time in the room practicing healthcare with you. So the third thing we want to talk about today is the after-hours call.
Imagine that you're on your way home from work and you're not feeling well. Just call the 888 number, and within 5 minutes, we'll have you on the phone with a provider who will guide you to the right type of care. About 70% of the time, we can provide a diagnosis and write you a prescription over the phone. That way you don't have to worry about calling in sick or taking time off to go to the doctor. But if you do need an in-person appointment, we're going to schedule it for you and direct you to the right place of care for your needs. We're going to get them all your information ahead of time. A member of our medical staff will actually call ahead and talk to the attending physician to make sure they know why you're coming. This will save you time, hassle, and money. Remember that if you have the Everyday Care Plan, prescriptions are included with the discount program.
What we see with a generic script is that it's normally about $4 to $12 with this coupon compared to a normal copay of, say, $10 to $20. So we can actually save you money if you use this coupon program or your discount card.
For brand name drugs, we always follow the same process. But as you know, brand name drugs can be more expensive. So please call the 888 number ahead of time and let us help you find the best prices.
Most people will say when they go to the pharmacy to pick up scripts, they're either going to CVS or Walgreens. These tend to be the highest cost. So what we would do is we would call you and let you know, Hey, I know you want to go ahead and go to Walgreens to pick that up, but just so you know, at Fry's, it's $11, not $47. Most of us are going to pick to save $36. So the last and the fifth thing that we want to talk about is the what ifs. Now we hear a lot of these types of questions. Well, what if I get in a car accident? Well, what if I break my arm? Or what if something catastrophic happens?
These would all require non-routine care. In each of these situations, we follow the exact same process. First, we're always going to get you the best care possible at a fair price. We don't want you spending thousands of dollars for an MRI when we know we can get it done for a fraction of the cost. Second, we'll look for any government or private patient assistance programs you might qualify for, which means that in many cases, you'll pay nothing. And last, we'll use any insurance you might have, but only if it's needed and will save you money.
So with the broken arm example, what happens if you break your arm and with your plan, you don't have any coverage? What do? The first thing we're going to do is we're going to see if we can get you into the no-cost visit. Remember, you have unlimited primary care and unlimited chiropractic. So if we can get you into a primary care visit at no charge to check the arm first and to get an x-ray done there, we're going to do that. If we can't, we're going to make sure we send you to the lowest cost imaging place.
The next thing we're going to do is set an appointment for you with a provider to make sure the arm is set the right way.
And we have 18 years of experience using the right doctors, and we're going to get you the lowest cost every single time. Then we're going to call you and we're going to make sure you know every step of the way exactly what you have to do. We actually put you on a special list with something like this.
And every day we have a huddle to discuss your case and make sure you know what to do next, so you can get the best quality care at the lowest price. And one of our favorite parts of this meeting is what we call the Energy Update, where we share success stories from our members. It's our goal to provide you a great healthcare experience, so you'll want to share your story. So let's do a quick recap about your everyday care plan. The first and most important thing to remember is that no matter what you need, just call us at the 888 line 24/7, 365 days a year, in English or Spanish. We also talked about what to do when you need routine care during normal business hours and how we streamline that process for you. Remember, you don't have any deductibles or copays for routine care. Third, we discussed what to do when you need routine care after normal business hours. Just call the 888 line and we'll do our best to get you to the right provider at the right place of service. Next, we talked about the discount program for your prescriptions and how to keep your costs low by getting them filled at supermarkets like Walmart or Kroger, instead of going to drugstores like Walgreens, where the prices are inflated. And lastly, we addressed all the what ifs and how we help get affordable, high-quality care when you need non-routine health services. Hopefully you now have a better sense of what to expect as a Redirect Health member. The most important thing is to call the 888 number whenever anything comes up. Our care logistics team will handle everything from there to make sure your needs are taken care of.